I don't think so. I don't think so, because this is all regulated too, you know, and getting a virus from a surface has to be in a specific scenario, like somebody's coughing and sneezing, and you go in and put your hand on a table, and then you come back and touch your mouth or nose. This is how usually it's transmitted. And from person to person is within 6 feet. So there is a person-to-person transmission and also a very small mode of transmission, yet it's not the main mode of transmission, is from surface to person.
Yeah.
So, you know, avoiding Chinese food or avoiding products from China is not going to protect from the virus. What's going to protect from the virus is infection prevention and what we talked about before, and self-quarantine, and avoid mass gathering, and if you're sick, stay home.
Yeah, I know the governor mentioned several times, don't panic, just practice good hygiene.
Yes, yes.
And that's the biggest thing you can do.
Don't panic is a good word. It's a good word to spread. Do not panic.
Yeah. You mentioned earlier, you know, there is no vaccine. That's one reason why the concern is so high about this. Have you heard anything about when a vaccine might be available? Is it going to still be some time?
So the virus has been isolated by the CDC. And the virus has been handed over to the NIH, the National Institute of Health. And as we speak, to the best of my knowledge from reading, that there have been some work done on developing a vaccine. We know the virus has protein spikes that spikes out of it, and this is how the immune response of the body is developed, and they're trying to make a vaccine from these protein spikes that are on the outer surface of the virus. But when will the vaccine be available? I have no idea.
Yeah, and it often takes clinical trials before it'll be available widespread to the public, and just that process alone can take easily up to a year. Yeah.
Yeah, I think I've heard, you know, it may be a year and a half or so.
Yeah.
So
but you know, later better than never. So because as we said before, we don't know how long the COVID-19 will be with us. It might be another illness, like the flu, or it might not. We don't know. But if it is, we need a vaccine for it, and we need a treatment for it for sure.
Right. Dr. Bremen, what if somebody tests positive that's in one of the ARH hospitals? What would then happen?
Yeah, so at ARH, as I mentioned earlier, we've been preparing for this. So one of the key things is for a patient, even a patient we were testing and had a suspicion they might have COVID-19, we would isolate them in a negative pressure room. We would have our staff appropriately gowned in what's called personal protective equipment. So all of those measures are hardwired at ARH, and we are ready to put into place. So if someone does present at any of our facilities that's at risk for COVID-19 or is ultimately diagnosed with COVID-19, then we would take care of them and support them.
Can you say with any certainty that someone who's been very ill, say in the last couple, 3 months, that might have been diagnosed with something else might not have really had COVID-19? Do you think some people have not been diagnosed that really have it?
I cannot say it is impossible. It's always possible. One of the criteria of the CDC when to test for the virus is a mystery respiratory illness, where you cannot explain it by anything else, with respiratory failure and pneumonia. This is when you test for it. But whether somebody been from 3 months ago diagnosed, couldn't be diagnosed and could have had COVID-19, less likely or unlikely, even though I cannot say 100% no. Because, you know, we started this on January 19 when the CDC took over here, and that's only like a couple months ago.
Right.
And it started in China a little bit before that, and you have to assume the travel, you know, we're just now seeing the new cases. So I wouldn't say 100% no, but I would say unlikely or less likely.
Do we know how this originated in China?
Wow, this is $1 million question. So how did this originated in China? We don't know. So you're looking for what we call patient zero. We don't know.
Yeah.
No, we have not, or they have not, found patient zero yet. But it started in China. It was thought to be from the animals and the bats, because we know coronavirus can live in bats and camels and cats. And we thought it was animal to human transmission, but then later on from Wuhan, it's also person-to-person transmission. So patient zero has not been found yet, so we don't know how this started.
I do want to talk about the flu a little bit while we have some time. That certainly affected our region a lot this year, even our newsroom. I was telling you before we started, we've had several flu cases just here in the newsroom. It seems like the flu is worse this year than usual. Is that right?
Well, I would say the flu is bad this year. Is it worse than usual? I don't know. I don't think so. I think we're just having our season of the flu. And it's been manageable, yet we have many cases of the flu. The only advice I have right now is get the flu vaccine.
So it's still not too late?
No.
You would still advise people that didn't get it last year, when the season started, to get it now?
It's not late. It takes 2 weeks to develop protective immunity, and it's never late to take the flu vaccine. Some people will say the vaccine doesn't work. Well, as an infectious disease expert, I would say the vaccine works. It might not work 100%, but people who got the vaccine and developed the flu are less ill or less sick than patients who did not get the vaccine in the first place.
So you can get the flu if you get the vaccine, but it probably won't be as bad.
That's correct. You can get the flu if you got the vaccine, but not from the vaccine. You can get the flu, but it will be a less severe illness most of the time than the original illness.
Mm-hmm. I believe it came out last week, 20,000 deaths from the flu across the United States, and it's been particularly bad in children, which is direct opposite of the coronavirus, which is doesn't seem to be affecting children, but the flu it seems to be worse in children.
That's totally two separate viruses, but that's true. Classically, from the years that we've been working, the flu has propensity for children, elderly, pregnant women, and patients with morbid obesity. These are 4 categories of patients that get affected by the flu more than any others, and you just touched on it. Children are one of them. That's why children should all, ALL, be vaccinated for influenza or the flu.
What have you seen at ARH hospitals with the flu this season? Does it seem to be worse than usual? I know you've only been here, 4 years in Eastern Kentucky?
Well, it's certainly, I would echo what Dr. Cotter has said, is that we've certainly seen influenza in our hospitals, and we've been taking care of patients, but I wouldn't say it's worse than usual, but it's certainly prevalent.
One person asked, are there any certain vitamins or anything else you can do to help boost your immune system?
That's a good question. Well, what helps boost your immune system is stay healthy and avoid factors that lower immunity, smoking, steroids, stuff like that. But vitamins by itself is not going to boost the immune system. Just stay healthy on a balanced diet. Do what you have to do to stay healthy.
So taking a vitamin C pill, not going to help too much?
Studies have showed it doesn't.
Really?
Studies have showed it doesn't. I mean, people feel better when they take a vitamin or a multivitamin, but scientific studies have showed that it does not help.
Yeah. I do want to put up the website and the state website and the phone number briefly before we go, and that website is to go to get all kinds of information. There's a ton of information. I looked at it earlier. It's kycovid19.ky.gov. And there's also a hotline, a statewide hotline, 1-800-722-5725, that you can call and have your questions answered if you have anything. In our last 3 minutes or so, what are the key takeaways you want people to know about COVID-19 and the flu? What is the most important takeaway from this?
The most important takeaway is prevention. Wash your hands. Avoid touching nose, mouth, mucosal surfaces. If you're sick, stay at home, self-quarantine yourself. And you can either stay home and work from home. It's better not to go into the public. If you are sick, go see your doctor. If you have traveled to an endemic area, let your doctor know. And for the flu, the same thing. If you're sick, go to see your doctor. And there is a vaccine that you can still take. We still not have finished the influenza season yet. There's treatment for the flu. And do not panic. There is doctors and hospitals to take care of you. As far as ARH organization, I'm going to let Dr. Bremen also finish with this. We are ready. Our clinics are ready as well to take care of these patients. And we're in this together. nobody really has the key answer here. We're working as community to find a solution for the sick and also to find a solution for treatment and vaccine. So do not panic. The medical community and everybody is taking care of part of this.
Dr. Brandt, I don't want to get into the politics of this at all, but you know, this is obviously affecting the stock market. It had another terrible day today. A lot of people were worried about that. What do you feel like our state and national response has been enough so far?
You
from
know,
what you've seen?
I really want to commend Dr. Stack and Governor Brashear in their response, particularly in the state of Kentucky. They have been very proactive. They've been incredibly transparent in getting information out. So the state of Kentucky is ready, and they have done an excellent job. Nationally, I think our CDC, Dr. Fauci, who heads up the NIH Department of Infectious Disease, are exceptional, and they've been getting great information out there. Websites are updated, and so we have a lot to be proud of.
I know, you know, in the last few weeks, people will call or message saying, oh, there's a case here, there's a case there, and we've called and it's unfounded. Can you say for certainly, if there's a case in the ARH system, we're going to know about it quickly?
So what I'd like to say is that there has been some misunderstanding. As Dr. Cotter mentioned earlier, the coronavirus has been around for a long time, and there are 4 types of coronavirus that we test for that are very common. And so we've had a number of our patients who've tested positive for common coronavirus, that's like the common cold, and we've seen those posted up on social media saying, oh, I have the coronavirus. That is not COVID-19. What I can tell you is that ARH will keep all patients' information confidential, but we will report to the Kentucky Department of Public Health as required. So any information on additional cases will come from them.
While protecting the patient identity.
Exactly.
Okay.
Yeah.
Okay, we're going to leave it there. Thank you very much, Dr. Brayman, Dr. Cotter.
Thank you.
Thank you. And hopefully we won't have to have you back on to talk about how worse this is in a few
anytime
months.
you want me to talk, I will.
Okay.
That's what we do.
We appreciate you.
Yeah.
Thank you.
Thank you.
Thank you for joining us. We'll see you next time on Issues and Answers.